Good morning, everyone. Good morning, dear patient, dear colleague, and friend. First, I want to wish all of you all the best for 25. So, today we have the next lecture, and I will talk about the understanding of pelvic pain, understanding pelvic visceral pain. That is a typical pain all patients affected by endometriosis does experience every month. So, from the neuropelveological point of view, pain, low pelvic pain don't mean endometriosis or myoma or infection. We are in neuropelveology, we are not jumping from the symptom pain directly to the cause. In neuropelveology, we try to understand the mechanism of the pain. And pain don't mean myoma, pain mean an information, what we call in medicine a stimuli, that occur at the level of the pelvic organ, the pelvis, the skin, or the lower limb, a thermal, a mechanical, like simply touching, or a chemical information. And this information of pain will be transmitted to the spinal cord through the pelvic nerves. And in the pelvic nerve, you have two kinds of nerves. You have the somatic nerve and the visceral nerve or autonomic nerve. The pain will be not the same. So the autonomic nerve is the somatic nerve is like the sciatic nerve. So an endometriosis of the sciatic nerve, the pain information, which is created within the sciatic nerve, will follow the sciatic nerve, then the sacral nerve root will reach the spinal cord, and from there, the brain. Now, the second, the autonomic nerve, on the million of small vegetative nerves everywhere in the body, everywhere in the lower pelvis, within the organ, within the bladder, the uterus, and the rectum. And this nerve will bring the information through what we call the plexus or hypogastric plexus, pelvicus plexus, and from there to the spinal cord, and from the spinal cord up to the brain. And first, when this information will reach your brain, then you will become aware, I feel pain. And then at the level of the brain, the pain will be perceived by the brain and will be modulated. The pain will be increased or the pain will be decreased. Your brain will recognize if this pain a danger or not a danger. And depending from this pain and the way of your brain to assimilate and to control this pain, the brain will give information backwards, what we call feedback, and will give an information, for example, pain in the bladder, the brain will say, go on the toilet. Or suppose you feel pain in your foot, your brain will say, retract your foot, take it away from what induces the pain. And that is pain. It's a neurological process. It's not a gynecological or urological or orthopedic process. Pain is an information that reach your brain. And that's the reason, for example, if you're getting a C-section, when you do a spinal cord blockade, anesthesia, you block the transport of pain information to the brain. And for this reason, you don't feel pain even when the surgeon is opening your abdomen. So, now, today, we are not talking from somatic nerve, also endometriosis of the sciatic nerve or schwannoma or pathology of the somatic nerve. We are talking from the pelvic vegetative nerve system. And in the pelvis, you have two vegetative nerve systems. One is the parasympathetic nerve system called rest and digest nerve system. This system deal to conserve the energy in your body and to maintain your body resting in a resting state by regulating functions as the digestion, the cardiac activity, and the respiratory rate. Now, on the other side, you have the sympathetic nerve system, also called the fight or flight sympathetic nerve system. And this system prepares the body to react to stress or danger. So, when a patient develop pelvic visceral pain, for example, like in endometriosis, is because of an overactivity of the fight and flight nerve system. The parasympathetic rest and digest system is also in charge of voiding function of the rectum, of the bladder, and in male on the erection. So now the typical symptom of the pelvic visceral pain. There is a lot of symptom because it's not just I have low abdominal pain. Once you have an overactivity of the sympathetic nerve system in the pelvis or somewhere else, you will have an overactivity of the whole sympathetic nerve system in the entire body. So you will experience cardiovascular symptom. So you will develop what we call a tachycardia, an increased cardiac activity to pump more blood to the muscle and to the vital organ like the lung and the brain. You will have an increased blood pressure due to a vasoconstriction of certain blood vessels, for example, the blood vessel of the intestinum, of the bowel. So it will reduce your bowel activity. And remember, that is a fight and flight response system to react to a stress or danger. So if you have to run away from a danger, you will need more air. So you will develop respiratory symptom to with what we call tachypnea. That means rapid breathing to simply supply more oxygen to the body and to the muscle of your leg to run away. And to bring more air in the body, you will have an expansion of the airways, what we call a bronchodilation. So you will have further symptoms that are the cardiovascular symptom, the respiratory symptom, and you will have what we call a tense muscle. Once again, fight nerve system. You will act your muscle, a tense muscle, to prepare for action or escape. And because of the stress, you will start to develop some shaking or tremor due to heightened alertness and energy release. And now on the right, what I mentioned, the blood flow from the bowel is decreased. So you will have a decreased digestion. If you take food to you, you will feel bloating for hours after you took the meat. And very, very important to recognize sympathetic nerve system is what we call the mydriasis. Mydriasis, that means you will develop a pupil dilation when you're in the darkness or when you're suffering from fear. You will have an opening of the pupil in order to better see. And when you're afraid, when you are stressed, when you have an overactivity of the sympathetic nerve system, typically you will have a reduce of the wetness of your mouth. That means you will develop dry mouth and dry lips. That is typical for an overactivity of the sympathetic nerve system. And of course, you have blood supply in the skin as well. So when these vessels are decreasing the diameter, you will become pale in face. You will see some flush skin, especially in the neck, some red area, even when the rest of your face is white, pale, and you will start sweating. You will see an hyperdrosis, you will sweat under the shoulder, but the sweat will be cold. And that is typical for an overactivity of the sympathetic nerve system. So then you will have neurological and emotional symptoms with increased focus and sensory perception. That means heightened alertness. You will have a sense of urgency or inability to relax, what we call restlessness, restlessness, and you will develop anxiety and fear due to the stress response. You will have an increased blood glucose level for rapid energy supply, and you will have experience a release on adrenaline and norepinephrine in your blood, which hormone amplify the sacral nerve system. So you will develop all the system. You will your mood will change. You will develop fatigue. You will develop migraine. You will develop pain everywhere in your body, even in the shoulder, on both sides. On the right side, every gynecologist will think maybe you have an endometriosis of the diaphragm. But if you report about pain on the left side or even in the arm during men's bleeding, no any gynecologist probably will believe this pain or will link this pain to endometriosis or any issue in the pelvis cavity, but it is because all these symptoms are not associated symptoms. They are part of the pelvic chronic pelvic visceral pain. You will not have an overactivity of the pelvic sympathetic nerve without all these associated symptoms. So you're not crazy when you say, I'm depressive, I have headache, I have pain everywhere in my body. Or even if you're falling down, if you experience episode of syncope, it's too easy to say, oh, you're a young lady, a little bit what we call in French mimosa. No, it's because of overactivity of the sympathetic nerve system. Think about if you look a box match in the television. If somebody get a punch in the plexus solar, it will fall down because you have an overactivity of the sympathetic nerve system that will induce a syncope. All these symptoms are part of the pelvic visceral pain. So that means if you have endometriosis in the pelvis and you feel that during men's bleeding you're tired, you're pale in face, you have diarrhea, you have to go very often on the toilet, you feel pain to your finger, to your hand, everywhere pain. Something is wrong in your body. You're depressive. You have no salivation in the mouth. All these symptoms and prove that you have an overactivity of the sympathetic nerve system. It don't prove that you're suffering from an endometriosis, but it proves that you have an overactivity of the sympathetic nerve system. And if the pain are located in the pelvis, it's an overactivity of the pelvic sympathetic nerve system. And it's true that in women, the most frequent pathology that may induce an overactivity of the pelvic sympathetic nerve system is endometriosis. And of course, the sympathetic nerve system, the activity, the overactivity of the sympathetic nerve system will be even more activated depending from if you have more stress, if you have anxiety, when there is a bright light, if a lot of people are talking around you, when you are loud noises around you. And that's the reason why most of the patients during men's bleeding with endometriose just one thing to go home and to lie in bed in the darkness in order to reduce all these stimuli which increase the activity of the sympathetic nerve system and then in turn increase the feeling of pain. So the cause, as a gynecologist, clear, we have to talk about endometriosis, but endometriosis is definitely not the single cause for chronic pelvic pain syndrome. Endometriosis, to say you're coming to a gynecologist, you have pain every month during your men's bleeding, so it's endometriosis, let's go in the OR, let's do a laparoscopy, or I give you hormonal treatment. No, it don't work like that because it could be an ovaritis, it could be a chronic inflammation in your pelvis, it could be uterine fibroid, but it could be also a non-gynecological cause. And you have to keep in mind that the pelvic visceral nerve within the pelvis are the same for the bladder, for the uterus, and for the rectum. So suppose you have an issue with your bladder, like an endometriosis bladder or an interstitial cystitis, you will develop the same kind of pain. And of course, if you go to a gynecologist, he will say it's endometriosis. You go to the urologist, he will say it's an interstitial cystitis or maybe a chronic bladder infection. And if you go to the gastroenterologist, he will tell you that you have an colon irritabilities, that means an overactivity of the bowel or any intolerance, again, gluten or whatever, or constipation syndrome. So you have, when you're a neuropelveologist, you have to take in count all these causes. And of course, to say it's more gynecologists, more coloproctologists, or more urologic issue, for that you need a clear diagnosis. And for that you need a clear patient history. So a neuropelveological diagnosis will not take 10 minutes, 5 minutes, and just 2, 3 questions. The neuropelveology patient history take at least 1 hour to collect all the information and to understand, okay, this patient is suffering from an overactivity of the pelvic sympathetic nerve system, but what could be the cause? So endometriosis can induce, of course, such kind of irritation of the pelvic nerve because of an infiltration of the nerves themselves. Endometriosis can attack as well the somatic nerve like the sciatic nerve, as the autonomic nerve, the visceral, or the parasympathetic. And when the nerve attack the parasympathetic nerve, the patient will develop difficulty to empty the bladder, to empty the rectum. When the endometriosis affect the sympathetic nerve system, the patient will have an overfilling of the bladder on the rectum. She will have to go much more often on the toilet. And that is exactly what all patients affected by endometriosis will experience. During men's bleeding, they have the feeling, I have a bladder infection. And most of this situation is not a bladder infection, it's an irritation of the nerve of the bladder. Then endometriosis induces as well an inflammation within the pelvic cavity, and this inflammation will induce an irritation of the nerve, creating exactly the same symptom of pain, headache, fatigue, and so on. And of course, the patient can have some scarring or adhesion in the pelvis that entraps the nerve, and this adhesion may induce chronic pelvic pain as well. So now, depending from your diagnosis, you will have to decide what to do. And of course, if at the end of your neuropelveologic diagnosis, you have the feeling, I have a potential cause, that can explain the irritation of the nerve, like an endometriosis. Then let's do a laparoscopy to resect this endometriosis and to release the nerve. Or when the patient is affected by an overactive bladder, then let's try first medication like anticholinergic. And if it don't work, then you can jump to a Botox or to the GNS therapy, which consists in the neuromodulation of the genital nerve to reduce the feeling, the frequency of the feeling I have to go on the toilet. And an overactive bladder cannot use pelvic pain as well as endometriosis. And suppose you have an outlet obstipation syndrome, your big bowel is too long, you will develop pelvic pain as well. And then the treatment is not to do an endometrial surgery or to give you some hormonal treatment, progesterone would even increase your pain because one of the side effects from progesterone is constipation. So if the main cause of your pelvic pain is an outlet obstipation syndrome, it's not a good idea to try with hormonal treatment. Then if you do laparoscopy, you can do a rectosigmoidopexy without using a mesh. Of course, you can try to reduce the activity of the sympathetic nerve system by using painkillers. But that is a treatment on long term. As long as you don't treat the cause, just the symptom, you will have to do the treatment for a long time. And suppose you try to treat endometriosis with hormone treatment or with painkillers, you will have to carry on with this treatment until you will become postmenopause with around 50. Because with an hormonal treatment, the endometriosis will not disappear. The endometriosis is just deactivated. Now, of course, you can have some life change that can not treat the pain, but decrease the intensity of the pain by management, use stress, yoga, meditation, and sport. Sport is a very a good way to decrease the activity of the sympathetic nerve system. When you're running 10 kilometers or you're swimming or you're hiking in the mountain, the evening you feel this peacefully tired. You want to go in bed because you're tired, you feel good, you feel well. That is because you empty your sympathetic nerve system. So, if you empty your sympathetic nerve system, you can reduce the intensity of the pain. You don't treat the cause, but the level of your pain you can decrease. And that way, you have two systems, two autonomic nerve systems in the pelvis. You have the vegetative sympathetic nerve system and you have the parasympathetic, and both are in balance. So once you can decrease the sympathetic nerve system, but you can also increase the parasympathetic nerve system. And for that, there is a very, very beautiful way to achieve that. Is what we call the vagus nerve stimulation. And the stimulation of the vagus nerve at the here, on the left especially, will promote such a parasympathetic activity which reduce the overactivity of the central and peripheral nerve system. This shift leads to decrease your cardiac activity, the blood pressure, and stress-related physiological response. So, with the stimulation of the parasympathetic nerve system, you will get much less sympathetic nerve system symptom, and you will sleep much better. You will improve your intestinal activity. You will have less constipation, and you will be definitively more relaxed. So, at the end of my presentation, you see that the diagnosis in neuropelveology is not where do you have pain in the low abdomen? Let's go in the OR. It's probably an endometriosis. As a neuropelveologist, the first step is to determine which nerve are involved with your pain and bring the information of pain to your spinal cord and then to the brain. And there are the somatic nerve, the visceral nerve, or maybe both. The second step will be to determine the site of the irritation or the damage in the nerve. Is the location, is the cause that induce the irritation damage of the nerve located in your brain, in your spinal cord, or in the pelvis, or even below in the legs? Because it makes no sense to perform a laparoscopy if the issue is in your spinal cord. So you need to know, if you do, for example, you plan to do a laparoscopy, you cannot just say, let's see, we do a laparoscopy and I will take a look to your pelvic nerve. No, that is definitely not an issue. It's too dangerous. Even any dissection of the nerve may induce neuropathic pain and disorder again. So, like a neurosurgeon, you're coming to a neurosurgeon and you said, hey, guy, I have headache. The neurosurgeon will make a clear diagnosis, because the treatment, if you have an aneurysma in your brain, or if you have a tumor in the brain, or if you have an infection or your brain, or you have just a migraine, of course, in all situations, you have brain pain, you have headache, but the diagnosis is not the same, and of course the treatment will be not the same. And in neuropelveology is the same. If you have a compression nerve by vessel, or destruction of the nerve after surgery, or because of an endometriosis, or you have an overactivity of the pelvic sympathetic nerve system because of an overactivity of the bladder, an interstitial cystitis, or maybe a diverticulose of your rectum or your bowel, the treatment will be not the same, even if the pain is the same. So your chance to have much less pain is depending of course from the treatment, but much more for the diagnosis. The treatment will be as good as the diagnosis will be. And that is a key message I have with this lecture. The diagnosis is the most important. So my mission is the education of patients in neuropelveology and endometriosis to improve your condition. So if you have pain every month during men's bleeding, and you feel all these vegetative symptoms I described, it's not because you're crazy, but because you have an overactivity of the sympathetic nerve system. But on the end, to say you have an endometriosis, let's go in the OR, or let's try the hormonal treatment, that is a much too short way of thinking and making a diagnosis. I hope that with my lecture, I can bring you some understanding maybe of your condition. Let's get maybe in touch, and thank you very much for your attention. Bye.